Hi, I'm PA Williams, and today we're going to talk about Botox and some different features of the uses of Botox. And Tami's here to help us demonstrate actually injecting Botox and where she might want to typically put Botox and where you might want to put it also. The most important key point about Botox is that it will help lines in motion. It does not help static lines. So static lines are lines that you might have at rest, and Tami doesn't really have too many lines at all, but she's trying to prevent them. So some of the lines that can form with motion, we'll have her scrunch. You can see some lines show up here, and we might call these like just early 11s. You can relax. So Tami doesn't want those lines to get deeper, but those are called lines of motion. When she created a motion with her brow, the little lines showed up. And then the same thing, the forehead, if she raised her brow, she gets some little lines across here. Also, with a smile, you can also see some little lines show up around the eyes. And those are nice lines, but a lot of people don't like them, and we can soften them. It doesn't mean she's not going to be able to smile anymore, but it will just soften those lines a little bit. Another feature of Botox that can be helpful for people is when we inject the forehead, some people can get tension headaches, and by injecting some Botox in the forehead area, it relaxes some of the muscles that can create tension in the forehead, and relaxing those can help us feel better. And another use even is like called Biofeedback to help with depression. So as we look at ourselves in the mirror in the morning, if our face looks kind of tired and kind of scrunched up and would look fatigued, we see that in the mirror and we can feel like more run down, more tired with that biofeedback that our brain's getting from our appearance. So psychiatrists have learned that if we improve the appearance of our facial muscles or relax our facial muscles, that gives our brain feedback that we feel better, and then our body feels better as well. We have found that patients actually do experience quite a bit of improvement in their overall mood after getting Botox. They do feel better. They get that somatic feedback to their body. It starts starting to release more, I guess, enkephalins, endorphins by the brain, and it does work. There's a couple of features about Botox on the packaging and the labeling that I think it's important for consumers to know, so that you know you're getting the real product and not a knockoff. There are some benefits of getting the brand versus other kind of like manufacturers' versions of like the Botox. One is that you are guaranteed to have the potency of the product. So if you're getting something that's a knockoff version, you're putting yourself at risk for probably like different types of viral disease, but also that the product probably isn't going to work even if you think that it's going to. One of the reasons we've moved away from using Dysport or Xeomin or some other manufacturers that make a kind of their own Botox product is that patients would come back and they wouldn't be happy with the results. It didn't work as well as Botox. They wanted to re-inject it with Botox itself. So that's why we use Botox, and we use it from the Allergan manufacturer.
So one of the biggest ways to tell that you're getting an Allergan product is by the black label on the bottom. It does have a QR code. If it's coming from out of the country, it's either going to be white or red, but it will not be a black label. They also have a sticker with a iridescent label on it. So those are two of the main features to know that you're getting an FDA approved USA product.
One of the other features, like aside from the box, that you might want to ask your provider about is the product is actually has like a safety hologram that's laser inscribed on the label itself, and once again the expiration date and the lot number should match up with what was on your box, and it should still be in like the same expiration period, which this one is. There's a recommended amount of Botox, and some people want to use a lot less, I would say use what your provider recommends because they know how much is required to relax that muscle, get you the results that you want. And you might say like, well, I don't want complete like frozen muscle, I want a little bit of activity, and you can work with that. But usually the recommended manufacturer amount isn't going to completely freeze the muscle, you're still going to have some muscle activity. Standard dose for the glabella area here to prevent those 11s may be anywhere from like 20 units to 35 units for a man. So one of the benefits of relaxing this muscle group is that it can soften or atrophy the muscle a little bit, giving a more feminine brow for women, and also kind of decrease or help prevent those lines. So we're going to go ahead and inject her glabella area. So we're just going to use a little pinch technique, and this often distracts the brain so you don't feel as much of the actual poke from the needle poke. And that's as easy as it is to get Botox. So we usually do 5 injection points for just the glabella here. We're going to do a second site here. Pinch. As we're doing this, is it on a scale from 1 to 10, how much does this hurt? 10 being the worst?
Like 0 to 1.
Okay, so minimal pain. Another key thing to think about too, just as a side note, to help me and help you so you don't have bruising after, is to not take any blood thinners within 7 days of your treatment. The goal is to make your lines softer and help you feel better and not give you bruises that you're having to cover up with makeup. So, and Tami's doing good. She's easily stopping bleeding where we're injecting pinch. And you might be asking, why am I injecting so far out on her brow over here when we're doing the glabella, which is traditionally this area? Well, part of the muscle that actually shortens to create the lines actually inserts over here. So as she scrunches, you can see it pulls from all the way over there. So if you don't inject out here, it doesn't relax the whole muscle group. The procerus muscle and corrugator are kind of work together to create the scrunch. So we kind of have to treat all the muscle groups to get a good result. There you go, done with the glabella. Okay, we've finished Tami's Botox treatment. In addition to her glabella, she wanted to soften the forehead lines. We did around the eyes here. You can notice that she has some little hive-type bumps that have formed after the injections. Not to worry, those will kind of fade within a minute or two. Some people, we can give them ice and it will make them go away faster, but that's not anything that's going to last a significant amount of time. You can eliminate this hive-type reaction from the actual just injecting the skin with needle if you take Claritin, like a half hour to an hour before your procedure, and that should minimize that kind of hive reaction our skin can get. We appreciate you tuning in to our Botox little introductory. Just to recap, I wanted to make sure that you understand it's important to use a good brand like Botox. It's not worth cutting a corner and trying to get a cheaper product that's on sale. It's not worth putting something in your body that could injure it. I mentioned, possibility of like venereal, disease or some other infectious disease you could get. Plus, the product's probably not going to work. Botox is a bacteria that is, cultured and made into like a purified protein by Allergan. They remove all the live bacteria. You can be guaranteed that that is going to be a pure product. With these knockoff versions, you cannot guarantee that. Also, in kind of recapping, the uses of Botox can be used for depression, as a biofeedback to help us feel better, and it actually does work. I've seen it on multiple patients we've treated over the last several years. It's also worth noting the difference between static and lines and lines in motion. The lines and motions are going to be improved most with the Botox. The static lines may soften a little bit, but not to any great extent, so don't expect those lines that are there when you're not making expression to really change. We can talk about that in a different segment about dermal fillers and how that can help the static lines. Thank you for tuning in, and stay tuned for our next segment about dermal fillers.